Patrik Hutzel from IntensiveCareHome.com, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies at home, and where we also provide tailor-made solutions for hospitals and intensive care units at home, whilst providing quality care for long-term ventilated adults and children with tracheostomies at home, otherwise medically complex adults and children at home, which includes home BIPAP, home CPAP, home tracheostomy care for adults and children that are not ventilated, home TPN, home IV potassium infusions, home IV magnesium infusions, as well as home IV antibiotics. We also provide port management, central line management, PICC line management, as well as Hickman's line management, and we also provide palliative care services at home. We're also sending our critical care nurses into the home for emergency department bypass services. And we have done so as part of a program at the Western Sydney Local Area Health District, their In Touch program, saving approximately $2,000 per patient that we could keep at home instead of going to ED. Now, today, I actually want to talk about a conference that I went to last week. I actually went to the Sleep Down Under conference, which is basically the Australian Sleep Apnea and Respiratory Conference. You know, one might wonder why, what does intensive care at home do at the sleep apnea conference? Well, the bottom line is that there's a lot of patients with sleep apnea that have complex disability and complex medical conditions, which is obviously a patient population that we can help. And that's why it was a very good conference with a lot of insights, but also with a lot of good networking. On Friday, there was a breakfast session sponsored by ResMed and done by the Victorian Respiratory Support Service, the VRSS, which is the statewide program caring for over 1,400 patients on home ventilation based out of the Austin Hospital in Melbourne. In the session, Dr. Anna Ridges, sleep and respiratory physician, presented a practical guide to initiating and managing long-term ventilation. Topics include a device selection, optimizing NIV therapy with case studies, remote telemonitoring for long-term patient care, and transitioning from pediatric to adult ventilation. It was a very good presentation. And one of the questions that I had at the end of the presentation once, Dr. Ridges went through, what type of non-invasively ventilated patients the VRSS is supplying equipment to, especially when it comes to MND, Motor-Neuron-Disease patients, whether some of them would have a tracheostomy. And the answer was that not many of them can have a tracheostomy because of lack of services in the community. And I say that is not accurate, and that is not true, because we have looked after a number of MND, Motor-Neuron Disease clients at home with a tracheostomy. We are still looking after MND clients at home in the community with a tracheostomy. And it was sort of brushed off saying, well, it's too difficult to get any support for them. Well, again, that is not accurate with intensive care at home. It is definitely possible to look after MND patients with a tracheostomy at home with 24-hour nursing care that is NDIS funded, right? And there was also comments made that the NDIS takes a long time to respond and isn't funding what clients are asking for. And once again, that is not accurate. We would not be in business and our clients would not be at home safely with MND and tracheostomy and ventilation if the NDIS wasn't funding 24-hour nursing care. So it's all a matter of what evidence is provided, what advocacy is being done. It all comes down to the right level of advocacy. And, I'm also aware that even MND Victoria is trying to dissuade patients from having a tracheostomy, saying that, the NDIS won't be funding nursing and so forth. Once again, that is not accurate. And I urge MND Victoria to do the advocacy properly, right? Because they're not doing it properly from what we've seen in recent months. Basically supporting the NDIS with not providing evidence-based care to NDIS participants with MND and their families, right? And that is not good enough. Now, case in point, some of you might know that, I have worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager in ICU for over 5 years, and I've been involved with intensive care at home as early as 2001 in Germany, where we were the first ones in Germany setting up intensive care at home, and we were looking after, a number of MND clients in the community there. And then with the tracheostomy, patients were given choice and control there and then and then by leaving intensive care with a tracheostomy and a ventilator and with 24 hours critical care nurses at home, right? An ICU bed, the cost of an ICU bed was cut by 50%. That's 50%. And furthermore, patients and their families could improve their quality of life and could live sometimes for many years. Think about Stephen Hawking, the famous scientist that lived into his 70s with MND on a ventilator with a tracheostomy, right? That is what MND associations should propagate, and not this limited mindset and saying, well, tracheostomy is no good, no one would look after you and so forth. Well, Stephen Hawking certainly lived for decades with this disease, and he could live because he had 24-hour nursing care, most likely with intensive care nurses, right? Because only they can safely look after ventilation and tracheostomy. And that is actually evidence-based. If you look up the evidence-based mechanical home ventilation guidelines on our website, it says that only critical care registered nurses with a minimum of 2 years critical care nursing experience, ideally with a postgraduate certificate, can safely look after ventilated and tracheostomy clients in the community. So once again, that is evidence-based, and the NDIS needs to provide evidence-based service, and so do other funding bodies. I mean, it's not unique to the NDIS. And as we all know, many patients in the community have died because of a support worker model on ventilation with tracheostomy, because they couldn't manage medical emergencies, which is why, once again, we are referring back to evidence-based nursing care, which is with intensive care nurses and critical care nurses 24 hours a day, so that patients can stay at home predictably and stay out of ICU, and more importantly, can stay alive, and not like with support worker models where support workers simply could not manage medical emergency that led to patient's death. And a support worker model is not evidence-based. There's actually no evidence, with all respect, support workers might have worked, in a supermarket the week before, and now all of a sudden they're being asked to look after someone on a ventilator on life support with a tracheostomy. The question is, why are we not having support workers in ICU if we think that's a safe model in the community where many people have died in recent years, right? So I'm just putting that out there. But thank you for Dr. Richards and for the Australian Sleep Association to put on this amazing conference last week. And I'm sure we will be back there doing some more networking next year in Adelaide. But, this is just some insights once again that tracheostomy is definitely possible, and, nursing care at home is possible as well. Now, with intensive care at home, we are currently operating all around Australia and all major capital cities, as well as in regional and rural areas. We are an NDIS approved service provider all around the country. TAC in Victoria, WorkSafe in Victoria, iCare in New South Wales, NIISQ in Queensland, DVA all around the country. Our clients, we as a provider, have also received funding through public hospitals, private health funds, as well as departments of health. We are the only service provider in Australia in 2024 that has achieved third-party accreditation for intensive care at home nursing. No other provider has created this much intellectual property for intensive care at home nursing than we have. We are therefore in a position to employ hundreds of years of intensive care and critical care nursing experience in the community combined. No other provider brings this level of expertise into the community than we do. And if you're at home already and you're watching this and you are on a ventilator, tracheostomy, BiPAP, CPAP, home TPA, and whatever the case may be, and you realize that your current setup is not working and is even dangerous, and that your current team is not having the skills and expertise you need to keep you at home predictably, and you feel unsafe, where you're going back to ICU all the time, or you're going back to hospital all the time, then you should reach out to us here at intensivecareathome.com before something serious happens. Like I said, many patients in the community have died on ventilation tracheostomy because of support worker model and not of a critical care nurse model, right? Makes perfect sense. Once again, if a support worker model was safe, why do we not have support workers in an intensive care unit? We don't even have general registered nurses in an intensive care unit. So why would we all of a sudden use support workers? So, and we have turned around many of our clients' lives by keeping them out of hospital predictably and out of ICU predictably. with our critical care teams, and we've improved their quality of life at home. And you should reach out to us here at intensivecareathome.com. Just call us on one of the numbers on the top of our website, or send us an email to info@intensivecareathome.com, so that you get the right level of care and the right level of funding. This is also why we are providing level 2 and level 3 NDI support coordination. Our NDI support coordinator, Amanda Riches in Victoria, has a wealth of knowledge, and I'll put a link in the written version of this blog to an interview that I've done with Amanda a while ago. We're also providing TAC case management and WorkSafe case management in Victoria. And if you're an NDI support coordinator watching this, and you're looking for nursing care for your participants, please reach out to us as well. If you're looking for funding for more nursing care for your participants and you don't know how to go about it and what evidence to provide, I also encourage you to reach out to us. We can help you with the right advocacy, and we also provide NDI specialist nursing assessments done by critical care nurses with a legal nurse consulting background. And if you are a critical care nurse and you're looking for a career change, we're currently offering jobs for critical care nurses in the Home in Melbourne, Sydney, Brisbane, in Albury, Wodonga, in Bendigo in Victoria, as well as in Warragul in Victoria and in Geelong in Victoria. If you have worked in critical care for a minimum of 2 years, pediatric ICU, ED, and you have already completed a postgraduate critical care nursing qualification, we will be delighted to hear from you. I have a disclaimer because we are offering a tailor-made solution for our clients, which includes regular staff. Our clients will have the same staff coming over and over again because they're so vulnerable and so special. It's all about building those critical relationships with our clients and with our team members and having regular and stable teams. That means if you're looking for agency work where you can come and go, this is probably not the right fit for you on a long-term basis, because our clients want regular and the same staff over and over again. So it's all about building those critical relationships with our clients. And we want to build relationships with you as well, of course, so that it remains a win-win situation. And if you are an intensive care specialist or an ED specialist, we also want to hear from you. We are currently expanding our medical team as well. We can also help you eliminate your bed blocks in ICU and ED for your long-term patients or for your regular readmitting patients with our critical care nurse team at home. We're here to help you take the pressure off your ICU and ED beds. And in most cases, you won't even pay for it. And if you're a hospital executive watching this and you have bed blocks in your ICU, ED, respiratory wards, etc., please reach out to us as well. We can help you. And if you're in the US or in the UK and you're watching this and you need help, we want to hear from you as well. We can help you there privately. Once again, our website is intensivecareathome.com. Call us on one of the numbers on the top of our website or send us an email to info@intensivecareathome.com. And if you like my videos, subscribe to my YouTube channel for regular updates for families with intensive care at home and intensive care. Click the like button, click the notification bell, share this video with your friends and families, and comment below what you want to see next, what questions and insights you have from this video. Thank you so much for watching. This is Patrik Hutzel from intensivecareathome.com, and I will talk to you in a few days. Take care for now.